session for today. Hopefully everyone can hear me quite well and you're all able to see my screen. So let's just take a look at where we were before. Recall that when we first log into the Medicare system, you're on the home screen. When you go to reports, you select e-reports from the list of possible systems. And from the e-reports, we can see that each of the different types of reports are listed on the left-hand side. We've been looking at this list of reports called complex and long-term care reports. When we selected that grouping, it showed us that we could look at individual reports, group or listed reports, and blank forms. We've been concentrating on the group reports. And so far, we've covered quality assurance, the administrative reports. We've looked at RUGS reports on the last session, and today's session is going to begin with the RAPs. Okay, so let's just select RAPs. And you can see under RAPs, we have several different options. There's a very simple, straightforward report that looks at all of the RAPs that are required and what percentage of individuals have triggered a particular RAP so that you're able to do your RAP summary as well as your care planning from them. Okay, so let's just start right here and we're going to pick the first section, RAP facility RAP report. Again, just like we've seen every other time, you can see that we can pick a date range or we can pick all of the active residents on their very last assessment they had. If we want to pick a date range, we can turn that off and pick any date range that we want. A given quarter, 2 quarters, 3 quarters, an entire year if we want to, okay, or more. The sector field doesn't apply to anything that we're doing, okay? So we don't have to look at sector. However, you can see that I don't have to have all of my nursing units. If I want to look at a given nursing unit, I can turn off all units and pick 1 or 2 of these units and look at the data just for those, okay? Let's go back to all units. Now, if you've been entering a particular program for residents when they come into your building, remember you do that through the ADT system. When a person first comes in, you say whether or not they're in a particular program, and these programs are completely up to you. You define what the programs are, and if you want to know how to do that, you can just ask support how to set that up in the settings. It's pretty easy. That allows me to look at people with dementia. I could look at my short stay people, my respite people. You know, if I have a palliative program, I may want to look at people and report on their data for people in palliative program. Also, I'd like to compare myself if I'm a hospital to other hospitals in the province. Or if I'm a nursing home, I want to compare myself to the 600 plus nursing homes, just to see how am I doing relative to these other groups. Okay, so we start off with a simple RAP report, which stands for Resident Assessment Protocols. And I'm just going to open that first report. And I've pre-run them again just to make sure that we can have as much time as possible. Okay, so here's the first report. I have 119 assessments altogether, or people. The average number of RAPs that have been triggered are 11.6, or nearly 12 risk areas. So 12 areas of risk per person. And then you can see here what are the different RAPs, and the delirium RAP, the cognitive RAP, we're all well aware of it. I know it's showing here, for example, and this is interesting. This is the ordinary RAI trigger, It just tells me how many people triggered and what percentage of the total. And you can see for delirium, I have nobody exhibiting those signs and symptoms of delirium. Whereas if you look at the provincial average for 600 homes, 18% of residents trigger on the delirium indicators. So I'm pretty surprised by that. And I would probably be digging in to my staff to find out, are they really coding that correct? Because 18% by provincially, and I'm showing nobody on the delirium indicators. Remember that comes from section B, that those delirium indicators, okay? Now on cognition, I have 116 of the 119 people, which is not surprising, not a great indicator. That's 97% of my residents, okay? And let's go down to some of the more interesting ones. And the one I'm going to look at here, oh, sorry. I want to look at this one for psychotics, right? Psychotic use. And this one is not antipsychotics. This is risk of any psychotropic, okay? You can see that of 119 people, 99 people are at risk in this area. That's 83% of the population. And for me, there's no low risk or medium risk. Everybody's high risk on that particular indicator. So you can see that's pretty high rate right across the board on that indicator, especially when you look at the provincial average. At 63% of residents are at risk for use of psychotropics, and I'm at 83%. So I've got a very high risk population here in relationship to that particular indicator. Now, please remember, these are not quality indicators, right? These are the things that are supposed to help us to put care plans in place before we have a problem or a bad outcome. The quality indicators are what we look at after we've done the treatment, and then see whether or not the things that we did to get rid of this kind of risk is it actually working? Okay. So let's just carry on with this particular report. Now that's interesting, these 99 people who are at risk, but wouldn't it be more interesting to you if you could actually find out who those people are? And then why are they at risk? What areas are they triggering for psychotropics? And you know that in your Medicare software, you can do that. And I'm going to just flip back here for a minute. You can do that by running these reports that are under the wraps. And this gives us a listing of all of the 18 wraps. So let's go in there, click here, and then these are the 18 wraps. I'm going to click on the one that says psychotropics, and then you can see the parameters that I could enter are just the same as I did before. Okay, mostly what I'm interested in, if I'm not using program, then get rid of program to group the data. If I'm not looking by several different quarters, then get rid of quarter, and we're going to look at nursing unit. And I want totals by nursing unit as well. Leave all of the other data the same, okay? Whatever you picked, whether it was a date range or whether you picked active residents, whatever number of units you picked, whatever number of programs you want to appear, okay? So let's see what this report looks like. And I've just made a quick copy here, and I'm going to blow this up so you can see it a lot better. You can see that nursing unit number 3 is the first one. And then it lists each and every person. But notice what it tells us. All of these factors that you see across here, all of these factors are what caused that wrap to trigger. So let's take a look at Mrs. Smith here, Francesca. She was high risk that triggered the antipsychotic to begin with. She's in the impaired cognitive group. Her ADL, that is her bed eating, toileting, and transfer, shows her at the mid-range. Okay, so she does have a fairly good ability for bed eating, toileting, and transfer. Her dementia, our cognitive score is 3 out of 6, so she's in the mid-range there. Now look at, this is where the indicators of delirium. Notice she has not triggered that. Change in cognitive status in the last 92 days, not triggered, right? Change, or she's the same as she was before, I should say. Change in communication, same as she was before. Repetitive movements, remember E1 are those mood items, and she's not experiencing that. Change in mood over 92 days, no change. Change in behaviors over 92 days, no change. Her sitting balancing is independent. Constipation's not a factor, fecal impaction, hypertension's not a factor, depression's not a factor. This is out of the diagnosis, I1 items. And then we're going to go into the J items. Dizziness is not a factor, hallucination, lung aspiration, fainting is not a factor, unsteady gait, falls are not a factor, fractures are not a factor, swallowing is not a problem out of the nutrition section. She's on 7 days of antipsychotics though. Remember that 04A out of the classification of drugs? She's got no days of anti-anxieties. She does have 7 days of antidepressants. So that's quite an interesting profile. There's not a lot happening there other than the fact that she's on 7 days of antipsychotics and 7 days of antidepressants. So that's probably one that I would really like to look at. And so you can see how helpful this report would be if you're trying to do any kind of a review with the ministry. I'm able to go to the first report that we looked at and find out the areas that I've got high risk or a lot of people. And then I can run the second report to find out exactly who the people are and what are the other factors that are impacting this individual. The other thing you might notice here is it's not the same for everybody. I mean, we have people here with unsteady gait and falls, right? We've got people here with signs of depression and hallucination. Now, the other thing that's really interesting here is that for this person, they did not check off depression under the diagnoses, but this person's on 7 days of antidepressants. So that's pretty interesting. And this person does not have depression triggered, but they're on 7 days of antidepressants. So there's something really strange in that coding, and this report helps us to reveal those strange factors. Okay? So let's just close those 2 reports out. And we'll go to the next report that's in the wrap box. And this one's called the wrap summary report. So I'm going to click on that to bring the report up. And I'm not sure what this report does, so I want to look at this report description. And you can see here, it says that this is a summary of all of the triggered and signed wraps for assessments during the period that we selected. Now that's interesting because this is telling me that I can see every single wrap that was triggered for every person and whether or not those wraps have been signed off. And if you're the RAI, you know how valuable that can be rather than have to go into the wrap system, open up each person's wrap individually, and then scroll down seeing if every wrap's been signed off or not yet. This report is going to let you do that all at one time. Okay? So it's called the wrap summary with signature. And I just click here, and again, let's blow this up. Now, you're not going to see any signatures here because this is real data and I'm not letting you see who signed or didn't sign. But notice for the first wrap, is it triggered? Is it been signed? Is it triggered? Is it been signed? Now this one makes sense. It wasn't triggered and nobody signed it. This one says this wrap number 2 for that person, again, the same lady we were looking at a moment ago, and it's showing not signed, but in fact, because I removed all the signatures, you're not seeing them here. Okay? And you'll notice this pattern's different for each and every person. So what do you expect to see here as the RAI or as manager? You know, if you're the director of care, you want to know that your people are signing off all of the wraps. And you can see here, you would be able to see with this report at a glance, any wraps that are triggered but no signature is present. Okay? So that gives you a real advantage in going through that entire report in a very quick and easy manner to make sure everything that's been triggered has actually been signed off and you're ready now to go ahead and submit your data. Also, a very good report to show the ministry when they come in if they're doing a care plan and wrap review. Okay, nice, quick, and easy report to show that you do have a method in place to ensure that all triggered wraps have been reviewed and signed off. So very, very good report in that aspect. All right, let's go back here again. Oh, I clicked on something crazy. To reports, we're working in the wrap grouping here, and we saw that we just went through the wrap summary, and we were able to get the reporting out of there to tell us exactly which wraps are triggered and are they all signed off. Now let's look at this one called the wrap and care planning. I like this report as well. It has the same kind of parameters, right? Any date range, last assessment, units, programs, right? A couple of interesting options here. This is one where I can look at get a listing of all of the assessments that haven't had the VB1 and 2 done, which is the signature for wrap, and a list of any assessments that haven't had the care plan signed off. So you know that in Medicare, when you do the wraps, and you're also signing off for the care plan at the same time. So that VB1 and VB2 both get signed off at the very same time. But this again is a report that gives us similar information to the last report. And let's just have a look at wrap and care planning signatures, VB1, 2, and 3, and 4. And let's just click there, and we're going to bring this one up. And once again, I've removed the signatures from here for the people because it is real data. But you can see again for this person that in the wrap summary, when you're doing it and you're signing off, it shows you a little more detail than the last report. It gives you the assessment reference date. It gives you the date that the wraps were signed off for that person. It gives you the signature of the person who signed it off. And then for the care plan date, the care plan was agreed to, and then who signed off that as well. Okay, so very similar report, a little more detail on the assessment dates and the actual date that things were signed off. And of course, what's the added feature here versus the last one? Well, here you're not looking at the individual wraps and whether they were signed off, but remember the REI coordinator does the very final sign off once all of the other disciplines have signed off, and that's what you're looking at here, is that very final one. And this also lets you check that the signature date for the wrap is happening within the required number of days after the assessment reference date. And we know for quarterlies and fulls, that's a 7-day window. Okay, so that's the wrap with the care plan on the overall signature. Now, the next report is this one that looks at groups for the RAP. And here we can do something a little different. It's very similar report to the facility RAP report. Only now I'm going to compare myself to all nursing homes. I'm going to take all my current clients, and I want to summarize the data, not for the whole facility, but I want to do it for each of my nursing units to see, is there different types of risk on different nursing units? And that makes sense. If I have an Alzheimer's unit, I'm expecting I'm going to see more psychotropic use. I'm suspecting that I'm going to see more risk for the use of psychotropics, I should say, in this case. I'm also going to, potentially see people who are at a higher risk of falls on a dementia unit. So looking at the data by unit might be interesting to do that. Now you can also graph this data as well if you want to show pretty pictures. And let's just see what this report looks like. So this one here, I've done two different reports. We'll talk about this one in a moment. Let's look at this one where we group the data by unit. So, and again, I'm going to bring that up so you can see that a little better. And let's take a look. And I'm going to go to the more interesting outcomes. I'm going to look at that psychotropic one. Pressure ulcers, pain, constipation. Okay, so you can see here that provincially, 85% of people are at risk. You see where it says residential for Q2 2017. Overall in my home, there's an 89% risk for pressure ulcers. You can see that the units are pretty stable, where Unit 7 has an 83%, but Unit 4 has a 93%. So that's a big difference between those two units. And if this was your home, you probably would understand why those people might be different, right? Possibly they are people with dementia and they don't locomote or move as much. So that's why they have this higher rate of risk. It's not quality now, it's risk that we're looking at. But you can see here for pain, my unit number 3 has a lot more risk than my other units, especially unit number 4, right? And it's even different than unit 7, slightly different than unit 8, okay? Risk related to constipation, this one unit, unit 7, really high risk. So pain and constipation for that unit 7 are major factors that we should be looking at. How are we planning for those individuals to make sure that these don't turn out to be bad quality outcomes or poor quality outcomes, okay? We're going to look at quality in just a bit. Right now, we're only looking at the risk part, the part that says you should do something before you have a problem. Okay, let's get out of this one. And then I've run exactly the same report here, this RAP summary by group, but what I've done is I've changed this part to look at a quarter. So for each quarter, what do I want to find out here? Am I getting more and more risk in this area, or am I managing my risk better and I have residents who have less and less risk in an area because we're doing good things? Okay, so this is looking at it quarterly. Obviously, I can't keep only the last assessment. I want to look at a whole range. So I'm going to set this up to have it from 2017. That's that's quarter 1 for 2017. And I'm going to take it right up to the end of that year, which would be March the 31st. And now that gives me a whole year of data, or 4 quarters, and I'm going to be able to look at my data by quarter now. So again, we're going to just click there to run the report, and I've already ran that report, so I'll just click on here. Let's bring this up so that we can see each of the indicators, and I want to go down to those same indicators that we had there before, which are the pressure ulcer and so forth. So remember, this is the provincial average, okay? You can see here that on a quarter by quarter basis, the risk for me has really gone up, except for this one quarter where it's back again. So just remember, we're looking at this quarter by quarter here. So that's the January to March of 2018 is this one here, starting from April of 2017. So that's all of quarter or fiscal year 2017 to 18. Okay, so let's go back down. We're looking at physical restraints. It said I had no risk in that area, less than 1%, little more than 1%, little more than 1%. So not much change there over time. So those are the types of reports, though, that help us to understand, are we improving, are we not improving over time at managing problems? Okay, so let's just quit out of the RAPS. So we've gone through that whole section that dealt with the RAPS. Remember when we came into the group reports under complex and long-term care, we went here to RAPS and we looked at all of these different reports. Now what I want to do is just give you a second. If you have any questions, a minute or so, and you enter the questions there, and then after the session's over, I'll take a look at them and I'll send out responses to everybody. Okay, so the next big section I want to look at have to do with quality indicators. Now these are the 24 quality indicators, which I prefer to the 35. However, the 35 QIs are the ones that appear on Health Quality Ontario, as well as the CIHI webpage. And they're also the ones that the ministry is paying the greatest attention to. So I'm going to start with the 35 QIs. Notice here we also have the CAPS, and you know that CAPS and RAPS are exactly the same thing. So everything I've just said to you about RAPS, it all goes for CAPS as well. And we also know that as time changes, the RAPS will be retired, and we'll pick up on the CAPS, and we'll have to learn the whole process over again. The CAPS are different in how they're calculated, and there's some new CAPS that weren't in the RAPS, and some CAPS, some RAPS are just completely gotten rid of, okay? So, but whatever you said, well, I told you about running reports for RAPS, CAPS is identical. It's the same thing with the 24 QIs and the new 35. Everything about running the reports is identical. So if you can see the types of reports here. So everything I'm going to say about the 35 QIs is going to apply to the 24, and we're going to concentrate on the 35. All right. So let's open that up. Just exactly like we did for the RAPS, right? It's all the same technique. Once you know how to run one set of reports, you're going to understand how to run every other report in the system. But let's start out and take a look at this. I'm going to start off with this one called the Facility MDS QIs. Nice, simple report. You can see here that it gives us either a date range, or we can say, I want to look at the latest assessments only. So the date range is completely turned off and has nothing to do with the people that are in this report. So this is for all of my active residents. That is, there's no discharge in the system for them at this time. And it's their last assessment that they had completed, okay? Programs and units are identical again. I can group the data here. I'm not going to do it with this set. I just want to give me all my data for everyone. I want to say, I want to see the results from the province. And I'm not going to bother with the graph. You can run the graph part too to get pretty pictures for the indicators. Okay. So let's then just take this report and have a look at it. Just a very simple set of parameters. I'm going to go under the reports that I've already run for the 35 QIs. And this is the first report called the facility report. And here we are. All right. So now you know that you can see here it's for 100 people. I wonder why it's not 119 people, because that's the number of people I have, and we saw from the RAP report. However, here, because of the exclusion factors, and I've discussed those in other seminars that I've done, people get excluded. So remember what happened. We never used a new admission in the 35 QIs. It is the case that we use new admissions in the 24 QIs, right? So in the 35 QIs, you got to be here at least 3 months or you're not going to be included in the report. So that's how we probably lost 19 people. The other thing is that you have to have a prior assessment in order to have some of the QIs calculated, especially the ones that do deal with improvement or decline. Okay, so a number of factors, we're not going to have all the people in the report. Now you can see that these indicators are grouped under indicators that deal with physical functioning, such as ADLs, psychosocial functioning, and you can see cognitive behavior, mood, safety factors, okay, other clinical issues. So those are the 4 major types of indicators according to the Inter-RAI group. We can also see here that it tells us how many people actually had a problem, how many people could have had the problem, that's the denominator, and then what's the percentage for our facility, and then how does that compare to the other hospitals or homes in the province. All right. So you know that late loss ADLs, which are the bed eating, toileting, and transfer, are a very important quality indicator. And you can see here we're looking at anyone who's had a decline in those 4 factors over that 3-month period. And so out of my total group, notice again, only 86 out of the 100 people that are in the report to begin with, other than the 19 on top of that, only 86 people are included for this indicator because these people had other factors, okay, that would have excluded them from this calculation. I have a 6% rate and the province has a 16% rate. So I had a lot less decline in that 3 months than what the province is showing up. So that's an incredibly good factor for me. And then let's go down and look at some of these others and get past the ADLs. We can see behavioral symptoms. I have 6 out of 100 people, 6% rate. The province had a 14% rate. So I'm giving myself a star again because I'm improving. Oh, I'm sorry. This is improvement. Made a mistake. I have far less improvement in behavioral symptoms than what the province is experiencing. Not a good thing on my behalf in that case. Okay, let's look at antipsychotics. Remember, we're in quality now, not risk. I've got 6 out of 35. I have a 17% rate. The province had a 20% rate in Q2. I noticed that by Q4, the province is down to about 19%. So there's been a little drop in that as well. but I'm in good standing at 17%. I have a 22% fall rate, slightly higher than the provincial average. 16% on infections, significantly higher than the province there. That would be an area that I'd be looking at. Ulcers, I'm 12%, much higher than the province. Worsening ulcers, I'm 7%, way higher than the province. And new ulcers, I'm 7%, again, way higher than the province. Nobody's restrained in my facility. That's a good thing. And you can see respiratory conditions, I'm double the provincial average. So that gives you a sense of how you want to use this report. The really important factor here, though, is being able to compare yourself to the province. That's the really big thing, so that you know, I've got a number, but is the number good or bad? Well, at least on average, it's not bad. If you're less than the province, and obviously if you're higher than the province, then there's concern. So we've done this now and we see what's happening. I'm going to stay with the antipsychotics. That's this one right here. Remember, I had 6 people, 17%. It would be good to be able to find out who those 6 people are, okay? And again, in Medicare, what you would do, in Medicare, what you would do is go to the next report under these 35 QIs. So you click there. You can see here, remember antipsychotics was under safety factors. Click there, and there's the antipsychotic report. This is going to list out for us all of those people. And I'm going to keep the same people, my active clients, all units and programs I'm going to keep. I'm going to look at it by unit, but I'll turn off program. And I'm going to turn off quarter. And I want to get the totals for each of my nursing units, so I'll turn that on. Okay, nice, simple report. And then let's just take a look at that report here. Okay. I only had 6 people, so these are the 6 people. You can see that 3 out of the 6 are on Unit 3, only 1 person from Unit 7, and 2 people from Unit 8. And then here's the actual indicators. These people look like, in general, they've got high ADL scores, so bed eating, toileting, and transfer is a factor. Except for this one person right here, which is about mid-range, okay? Cognitive factors for these people is here, but for here you can see cognition is not a big a factor on unit number 8. The aggressive behavior scale, that's an interesting one, because remember the hypothesis is that we tend to give antipsychotics to people without a diagnosis. Remember, they don't have the related diagnosis for psychoses. And you can see here that we've got high ADL, slightly high cognitive, but we've got aggressive behaviors, at least for these 2 people, but not for these people, okay? And so that's telling us something, that maybe we need to look at these 2 individuals here. Are we really treating aggressive behaviors and we're not treating dementia? Or which the aggressive behaviors could be because of the dementia, of course. We do see here that the Huntington's and the schizophrenia are not a factor. We see here that delusions and hallucinations, right? So these are not factors, and that's what we're supposed to be looking at. And this indicates that they don't have those indicators. We can see that all of them are getting 7 days of antipsychotics. And none of these people are in a palliative program. Okay, so that's what P1A0 is. It shows palliative. And J5C here is end-stage disease. So they're not end-stage disease. They're not palliative. Okay, delusions and hallucinations are not factors. Okay, and you can see here the psychoses from the diagnosis section are also showing they're not factors. However, these people are still receiving antipsychotics, and cognition and aggression may be why that is. Okay, so that's how that report is used in conjunction with the last report that we looked at. So I'm just going to close up this listing, and you can do it for all of the indicators. You saw that we looked at this report already. Let's go to this one called the QI summary. Once again, the parameters that you need to set, and notice the parameters are saved from report to report. I don't have to keep re-entering them. You just do it once and it keeps it for every report after that, assuming that you always want to look at the same people and look at them all in the same way. Now, the summary report is identical to this RAP summary report that we looked at, in that it shows you all of the QIs at one time. So let's just look at that report. And I'll bring that up again just to make it a bit easier to look at. And notice now the 4 areas: the physical, psychosocial, safety, and other. Each of the indicators underneath that, and you can see for this person, Francesca Smith, which assessment, what chart number, and then exactly what indicators. And notice she's only got 2 areas of quality concern. And this gives you the total number. And we know that once you get over 5, that's a bit unusual, because the provincial average that I've been tracking has been about 5 indicators. So here's a person who had an annual assessment, and you can see they've triggered 7 different areas of concern. This person 6, 2 more with 7 different areas of concern. And if we just keep moving our way down, we can see some people have no quality indicator problems at all, which is kind of suspicious as well. Okay, let's just carry on down, see if we can find out anything other. So 7 seems to be the highest number of quality indicators. All right, and if we go right to the bottom of this report, this is a really interesting factor. You can see that it shows me which indicators are coming up most often. Okay, so I'm going to bring this down a bit so we get a better look at that. And you can see here that this one for ADL, indicator number 5, appears 34 times out of the 100 individuals. Indicator number 6 under ADLs appears 38 times. Okay, and as you go across, 22 times for falls. And you can see, well, these are not that. Respiratory, I'm kind of surprised, 13 times, and so forth. And you can see altogether, let me bring that back up, 286 different quality concerns across those 100 individuals. Okay. So another great way of looking at your data and trying to track people who have the highest area of concern across quality within your facility. So let's just flip back to our report. And we saw that the report that we were looking at there was the 35 QI, and it was this summary report. Now let's move to this one, summary report by group. And again, quality concerns don't happen homogeneously across your facility. One nursing unit may be have more problems in a certain area of quality than others. So this report, which is almost identical to the very first report that we ran, but now we're going to look at it in groups, just like we did with RAPS. Okay, So I'm going to take all of my current residents, same programs in units. I want to compare it to Ontario again. I want to look at the data by nursing unit, and then I'm going to run the same QI report, only this time we're going to look at it by unit, separate out the units. So let's just blow this up, come across, and notice now that as we look at the different areas, and I'm going to find one here, the worsened ADL. Now that one is the looks at 7 different ADLs, and the maximum score on that scale is a 28. I like that one because it gives you the early loss ADLs, like hygiene. It gives you the mid-loss ADLs such as locomotion, and it gives you the late loss ADLs, the bed eating, toileting, and transfer. So a very important indicator. And here we're looking at people who have declined overall in ADL. And remember, we're looking at this by nursing unit. So I just want to bring those titles up a little bit here, so we can see the headings. I might have to make it a bit smaller, because I want you to be able to see the headings as well. Okay, so you can see here we have unit 3, 4, 7, and 8. We have the total for our facility. We also have the provincial averages for all 600 plus homes, but we're also showing Health Quality Ontario's average. And we know that they haven't picked them all yet, but now let's bring this back a bit and go back to that worsened ADL. The goal for the province, the future goal under Health Quality Ontario, is 25%. The current rate for the province is 33%. And notice here that my one unit has only a 4% decline in all ADLs, but that comes up to this unit that has nearly 15%. So more than 3 times the lowest. However, they're all better than the provincial average. Okay, so my nursing units, yes, there's variability. However, it looks like even though there's variability, we're much better. Okay, so let's just go down here, and I want to look at the antipsychotics, because we've been hanging in with the antipsychotics. Oh, sorry. Let me just click in here. Okay, and we can see Health Quality Ontario. I don't have the goal in there for health quality. I'm not sure if there's been one set. I believe they're trying to get to around 20%. The provincial average rate at this time, this Q2, is 20. Notice that antipsychotic use on this one is virtually, well, is 0. Antipsychotic on this one use is way down. These 2 units are higher, okay, than the provincial average at 25%. So do you see how this kind of report allows me to say, well, you know, there's no sense in me talking to these 2 units or having concerns. It's only these 2 units that I need to address. Look at falls, right? 10%, 30%, 14, 38. These 2 units here are the units of concern. All right, infections. You can see here that this one is okay. It's below the provincial average. However, these other units are all well above the provincial average. Okay, so even though my facility average is 16%, I've got units that are closer to 22% here. So another report that's very, very useful in trying to get to focus in on where your problems are. So let's just close out these reports and go back. Now, the same thing, I can go back to that report. Remember, I looked at it by unit. Now I'd like to look at it over time. Am I getting better as time passes? So I want to look at the report by quarter. I'm not going to be able to keep this for just the active because that's only 1 quarter. I'll turn that off. I am going to look at the entire year from April to March, okay? And then we run that same report and we can see here what the results are. And I'm going to go right down to the antipsychotics again. Remember the provincial average here? Notice that I was 22%, 20%, 21%, 23%. So there might be something happening here because I seem to be going in the wrong direction. Back in this quarter, I was looking pretty good. And here, I'm right at almost at the provincial average. However, I've been creeping up the last few quarters, and it may not be a problem. Could be just because you've had a few discharges that, that brought your overall percentage up. Could be because you have some people who are fairly new, just been there 3 months, and they brought your average up. But that is something you want to have a look at. Now look at the rate here that we're looking at. You can see fall rate. The Health Quality Ontario says should be 9%. The provincial average is close to 16%. And you can see that I'm very close to that provincial average, gone up a little bit in the last quarter. Infections, I was at 21. You can see I've managed to bring that down. Ulcers, I was at 7, dropped to 4, up to 9 at 7. So I'm not accomplishing a lot there. Remember, Health Quality Ontario wants us to be at 1%. However, we're not that far off of the provincial average, but we are off. Okay. So again, this type of report where you can break data down into more clear analysis by unit or by program. I mean, if you were using programs. And so this is a very handy way to be able to look at that kind of data. All right, so we've gone through the 35 QIs. Let's just flip back to our system. And I mentioned to you that the 24 QIs, you can see the setup is identical. There's a few extra added features, but basically this report is identical to the 35. This QI summary report is identical. This summary by group is identical, okay? So those are just the same formatting. I like the 24 QIs because it does not exclude as many people as this 35 does. It also gives me 2 different reports, one for my new residents, that is less than 3 months or less than 3 months, I should say. And then second report, which shows me people who have been in the building 3 months or more. So I just find it a much better set of reports. It's not so black box as the 35 QIs. And I would probably use the 35 when I want to compare myself to the other nursing homes in the province. However, the 24 QIs when I'm looking at how am I doing. Okay, so those are the types of things that these reports will allow you to see. I've already mentioned caps and wraps are identical, okay? So whatever you see in the wraps with its 18 different areas, you've got these 19 areas that are in the cap, but they're measuring the same thing. Activities, restraints, cognition, delirium, mood, all of those are the same risk factors, and the reports are run in the same way. The other set of reports that we have here just in our last few minutes are called outcome reports. And these are all of the performance measures. So these are the cognitive performance scale, the depression rating scale, the chest scale, the pain assessment, social engagement, personal severity, aggressive behavior scale, pressure ulcer risk scale, okay, the PRI. So all of these are those performance measures, and you can see here if we want to look at CPS as a beginning, you can get a listing of people with their CPS score, or you can get summary data. So let's just look at this. I want all of my current residents, and I want to know of the people that are in the building right now, because those are the ones I want to be taking care of. I want to know, what's the current situation. Now, you could break this down by nursing unit if you want to see if there's differences across nursing units, get the total, which would make the most sense to me. I'm going to turn off program, and I'm going to turn off the quarter, okay? I think I'm going to turn off quarter. What happened there? All right, we'll leave it on there for now. So I'm going to look at my active residents. This is all the same thing every single time, so we don't need to keep repeating that. And then you can run the report to look at what percentage of people fall within the different ranges of the cognitive performance scale, which I think is a very, very interesting way to be able to look at that data. And all of the outcome reports that you saw there, and I'm just going to flip over here for a minute, all of those outcome reports, whether it's ADLs, the depression scale, the chest scale, all of these, the reporting is identical, okay? So we don't need to run each and every one of those. You'll get the idea when we look at this. So if you remember, the cognitive performance scale, okay, is broken down into where percentage of people who are intact don't have a problem. So of our total number of people, 3 of them are at a 0 score on the cognitive performance scale, which goes from 0 to 6. So we have 0 score is intact, a 1 score is borderline, a 2 score is mild, 3 is moderate, 4 is moderate severe, 5 is severe, and then 6 score out of 6 is very severe. This tells us how many people, right? We have a total of 119, if you remember that, and this is the average score. So if you look at the first unit, the average score is a 3 out of 6. The next unit has a 4.5 out of 6, a 3 out of 6, and a 2.8 out of 6. Overall, all 119 people have an average cognitive score of 3.37. Now let's look at it the other way. I've got 3 people as intact, 4 are borderline. 28 of my residents are mild, 33 are moderate, 25 are moderate severe, 14 of them are severe, and 12 of these people are very severe. Okay, so can you see how that would be a very handy report to be able to look at? And then what would even be more interesting, if you ran this over a couple of quarters, instead of just 1 quarter like I have, if you ran this over a few quarters, you could see how the numbers are dropping off over time if you're actually improving things on that particular measure. Now, obviously, once again, just finally, I'm going to run one more report, and that's the list. And we're going to leave all of this exactly the same. You can exclude people who have a 0 cognitive performance score, but I'm going to leave them in. I'm going to keep all this identical. And then we want to run the report. Now, why do we have these listing reports for RAPs and QIs and RUGs as well? Because the other report just tell you 19 people, but you don't know who the people are. So how can you do anything? Okay. But this lets us go right in, and let me just bring this, oh, sorry. Let me just bring this up so it's a bit bigger for you here. So here's our first individual. Notice that we add in this other information, right? This person was a 14 out of 18 on the bed eating, toileting, and transfer. Their CPS score was a 2 out of 6. Okay, they're in the funding group called reduced physical functioning. They're not in a coma. They have a short-term memory problem. They're modified for decision making. They usually understand people in the communication, and they're limited assistance for eating. Now, why do I bring up these scores? The short-term memory, decision-making, communication, eating, and coma. Why am I bringing them up? Because those are the 5 measures that make up the CPS scale. And this helps you to understand that if a person has a CPS score, then which of the 5 factors are really kiting that up? Notice they're limited for eating, supervision, okay, limited supervision, high ADL scores, okay. So this is a way to get a much better sense of what cognitive performance really means and what factors are impacting that for these individuals. All right. And you can see if we go right to the bottom again, it tells us 119 people, average ADL score, average cognitive score, but you can also break that down by the nursing unit to see where do you have the largest problem and what area you have that problem. Well, people, that's it for today. I'll see you next week as we move along to the next reports. Again, thank you very much for being here. I enjoy doing this. And leave me any questions that you have about running those reports or interpreting the reports. And we'll see you next Tuesday. Bye, everyone. Hopefully I'll